Karibuni sana, bienvenue to the Pathology Network podcast.
Kenya, we have about 50 million people.
Right.
Half of that is women, so that's about 25 million. So if you're talking about 5% of 25 million, that's 1.25 million women dying from cervical cancer.
Right.
That's unacceptable. And that's why now HPV testing comes in. Just having the virus does not mean that someone is going to have cancer.
Right.
As I say, most of us will clear it. If I say I have like 10 women, I screen them, 8 turn positive, 7 will be fine.
Mm-hmm.
They'll clear the virus in a year or so, and they'll be okay. But there's that one woman who will not be able to clear the virus.
Gotcha.
And that's the one woman you're looking for.
Hello everyone, habari zenyu, good morning, afternoon or evening, wherever you are. Karibuni sana, bienvenue to the Pathology Network podcast. My name is Dr. Maureen Waithaka. I'm a pathologist, and today we have a very special guest with us. We have Dr. Anisa Mburu. Welcome. Dr. Anisa Mburu is a gynecologic oncologist, and today we'll be talking about HPV, the Human Papillomavirus. Welcome to the episode.
Thank you.
Welcome, Dr. Mburu.
Thank you so much, Dr. Maureen. Lovely to be here.
Great. So today we'll be discussing HPV, or the Human Papillomavirus, and in the context of cervical cancer, which is one of the most common cancers among women in Kenya and even globally. So what is HPV?
So thank you, Dr. Maureen. Now, when you're talking about HPV, it's the human papillomavirus.
Gotcha.
There's over 200 types, and about 100 of them affect humans. But then even when it comes to those types, they're again divided into 2 groups, where you have the low-risk groups and the high-risk groups. Now, the same way you have a name, Maureen, and I have a name, Anisa, the viruses also have names, but theirs are numbers. So you have HPV 6, HPV 11, and these are the low-risk ones that will cause things like genital warts, benign, very ugly looking, but cannot become cancerous.
Gotcha.
Then you have the high-risk types. Now these are the bad boys. You have the type 16, 18, 31, 33, the list goes on. And these are the ones now that are associated with changes in the cervix, the female cervix, that become cervical cancer.
Gotcha.
And one thing we need to know about the HPV viruses is that they not only cause cervical cancer, but they cause nose and throat cancers, what we call nasopharyngeal cancers, vaginal, vulvar, anal, and even cervical cancers.
Right.
So they're associated with a myriad of cancers.
Okay, so HPV is quite a bad virus for us, infection, and depending on the type, there are some which are associated with higher risk for developing cancer. Right. So infection with HPV causes changes in the cervix that lead to different types of cancers, including cervical cancer. So what can we do to be able to find out if we have the infection? Do we have any tests that can check for these changes before we get to the point that we have cancer?
Absolutely. And the beauty about this is that when you're talking about mostly cervical cancer, it's one of the cancers that we have understood it and understood it well.
Right.
And so when you know what causes it, then you can look for what is that cause. And if you're able to look for the changes that the virus is causing, then you can treat them before cancer develops. Okay. And that's why through a lot of testing that has been happening, we started way back when in, I think the 30s, where George Papanicolaou came up with a pap smear.
Right.
And it has been quite rampant. So the pap smear was more, it was a screening test, but it had a bit of diagnostic connotation in that it actually looked for the changes that have already happened in the cervix.
Right.
And when it does that, then the woman can be treated early and prevented from developing cervical cancer.
Gotcha.
And so over the years, from 1930, the 50s, when it became so rampant, then I think it was the 70s or 80s, then we moved into liquid cytology, trying to modify the pap smear. Then that's when now they came up with HPV testing.
Right.
Because we know these changes are brought about by a virus. So why not look for the virus even way before the cancer develops? And so the issue with that is mostly we're looking at efficacy and the ability to predict the women who require additional testing.
Right.
And the reason for this, like, yes, we're talking about cervical cancer. You said it's the commonest cancer, and it is. And after breast cancer, we have cervical cancer causing about 15% of all women's cancers.
That's big.
But it's the leading cause of death amongst women in Kenya and mostly sub-Saharan Africa.
Gotcha.
We're having over 4,000 deaths per year of cervical cancer.
That's a big number.
Exactly.
Yeah.
And so that's why we're really trying to focus on how we can better test these women, prevent them from developing cervical cancer, and at least remove or reduce that mortality.
Gotcha.
And that's why now HPV testing comes in.
Right. So we have screening tests, which sometimes can also be diagnostic tests. And then we have like the HPV DNA testing, which is a screening test. And we have been using pap smears for a long, long time. I think most women of a particular age have gotten at least one pap smear. We've been using them quite extensively, but there is actually a global shift towards HPV DNA testing in lieu of pap smear testing. Could you tell us a bit more about why that is?
Yes, like I'd mentioned earlier, with everything we have better development, better understanding, and better technology.
Right.
And that's the same thing when you're dealing about cervical cancer screening. Because way back when, they only knew the pap smear. And even the collection of the pap smear, you know, they used to use a glass slide to actually scrape the cervix.
Oh,
yes.
that sounds
painful.
Terrible. Yes.
Exactly. So and then it developed later into now the brushes that we currently use. Still uncomfortable, but can get the job done.
Right.
However, it has been shown that several studies, when it comes to the sensitivity or the accuracy of a pap test to pick out the changes, is much lower than doing a HPV test. Because we find that with a pap smear, there are problems threefold. Number one, with the pathologists themselves, because when they're looking at the slide, depending on where they are at the time, the kind of training they've received, the kind of facility they're working at, it can determine the kind of results that they're seeing.
I can confirm that.
Yes, as a pathologist, you can tell us exactly. And I remember there's one of the pathologists was telling us that he can look at a slide, then if he comes back after lunch, maybe he'll see something different.
Oh yes, we call that bench staining.
There you go. You even have a name for it. I didn't even know this.
You leave the slide on the table, and you come back and you're like, I'm seeing things I wasn't seeing before.
There you go. And so there's that major factor. Then the second thing is with the doctor who's collected the sample. They might not know how to collect the sample appropriately. Or they may collect the sample appropriately, but not smear it appropriately on the glass slide or preserve it well on the glass slide. And so you end up with false negative tests. Then comes now the cervix itself. I don't want to say the woman because it's like a fault.
Yes.
But sometimes the lesion or the place where there's abnormalities can be hidden. And so the brush, it's very light and very, it's even softer than a toothbrush.
For sure.
So it can just bend over and even skip the area that has the changes. And so you get a false negative. And you see, when you combine these three factors, it has shown now what we call the sensitivity of a pap smear can be as low as only 40%, meaning that it's right only 4 out of 10 times. So you give a woman a false security, that go out there and like, my pap smear is normal. I've seen this. They're good and they disappear. And you see, I've had women who've had a pap smear and like a year ago, then they come with overt cancer. Others, the other problem now comes, and this maybe I can say the fourth reason is, when it comes to women who already have cervical cancer and you do a pap smear on them, it can miss the actual cervical cancer.
Yes.
And you might be able to explain this better than I.
For sure.
You know?
Yes.
So you'll find that a woman will have had someone who doesn't know the cervix, doesn't know how it's supposed to look like, will do a pap smear, which they're not supposed to do anyways. Woman already has a cancer, and they'll say, oh, there's some inflammatory changes. And the woman will go away thinking that I'm fine.
Everything is good.
Exactly. And so this kind of problems and the way we have this high burden of cervical cancer, that's why now there's been change or shift in chances on trying to rather modify how we screen these women so that when someone gets a test, they can have a very high accuracy. And that's when now HPV comes in. Because if we test for HPV, it doesn't even have to be inside the cervix you're collecting the smear.
For sure.
Just in the upper vagina, you get a smear, and it's very, very accurate. I think it's about 95% sensitivity, so that means it's right 95 times out of 100,
which is
like
what we want.
Crazy.
Yes,
exactly.
that's
It's
really
amazing.
good. Yeah.
So the chances of us missing, it's very, very low.
Very low.
And so if a woman does not have the virus, we can confidently tell them, you know what, go away, come back after 5 years for another test.
Right.
But of course, in between those 5 years, every year just come for your regular checkups.
Right.
But the screening test can be done. It's so accurate that we can give the woman 5 years.
Right.
You know.
Yes.
And for those who now have the virus, then we can refer them appropriately for diagnosis.
Okay. So it gives more confidence to the patient and to the doctor that if it's negative, chances of her having cervical cancer or any precancerous lesions are very low.
Very low.
And also it's a bit less invasive because you can collect a sample from the upper vagina as opposed to the cervix, which is a bit further away. And I'm also hearing about self-testing. There is actually self-testing that's available for HPV. Could you talk about that a bit more?
So self-testing is actually God's gift to women.
Yes.
Because
I can testify.
Yes, amen.
Yes.
You know, because one thing we know about the HPV, when we're doing rather pap smears, right?
Right.
You need to have a speculum inserted into the vagina. And I'm okay to say this, we're doctors. Right?
Yes, for sure. Speculum is fine.
Yeah. So we put in a speculum, we have to open it up to be able to reach the cervix that is way up there to be able to scrap it.
Right.
It's painful.
Yes.
Women refuse to come to the hospital because of that, because they fear that pain. Now, with self-testing, not only do they avoid having to have a speculum put in them, they don't have to even have someone doing it for them, because it's a sensitive area. It's modesty comes in. You know, you don't want to just go having to undress in front of everyone. Even if it's your doctor, you feel there's always that embarrassment that comes.
For sure.
So if you're given the opportunity that you can collect a sample by yourself in the privacy of your home, of a lab, of a hospital, wherever, but you are on your own, you collect a sample that is accurate and it can be taken to the lab and you get your results which are correct. I mean, come on.
It's a godsend.
It's godsend.
For sure. So you avoid instrumentation, you avoid having to go in front of someone, have someone else in your private space. I mean, I can see how that would be way more attractive than the traditional way that we've been doing.
Absolutely. And another thing is that it can even be done in your convenience.
Right.
Because you can pass through a lab, pick the brush, go home, collect the sample, go do your work, your business and everything, drop the sample at the lab. So it doesn't have to be, I have to be at the lab at this particular. No, you drop it at your own convenience.
Right.
And you know, right now we're having a lot of busy working women.
For sure.
So it also saves on time. Right.
And the convenience must be unmatched. And nothing that we've had before is that convenient. And most of cervical cancer is caused by HPV. Am I right in saying that?
Yes, up to 90%.
Right. So if you capture, you're able to do adequate screening with HPV, you're able to find out a large majority of people who would be exposed to or prone to getting cervical cancer. You can capture a large group of them, which is why I think HPV testing is really, really important, right?
Absolutely.
Yeah.
And
go ahead.
There's something that I think we need to really mention is that HPV, not to cause any stigma or anything, but it's a sexually transmitted infection.
Right.
All right?
Yes.
And so contact through any kind of mucous membranes, be it the mouth, be it on the penis, be it on the vagina or the anal area, it can be spread through those surfaces.
Right.
And when someone has HPV, they cannot know that they have it. There's no signs, there are no symptoms.
Right.
So that makes transmission easy. Because if I don't know I'm infected, I'll just come hang out with you or be with my husband or something and I'll transmit it to him and we won't know. Or he will transmit it to me and we'll never know.
Right.
Because it's silent. It doesn't cause, if you have like the flu virus, you'll be all stuffy and everything. You'll even have to stay away from people for a little bit.
For
you
sure.
can even put on a mask, take some water, you'll be fine, and you rest and you're okay. This one you will never know. All right. So now that's why it's really important for people to be screened, because as much as we cannot screen men at this point, for women we can screen them. And so when that woman is well, when she is not having any signs, she's not having any symptoms, that's the best time that we need to screen.
Right.
And we always, as I said, it's a sexually transmitted infection, the commonest sexually transmitted infection, by the way. At any point in time, for a woman, 85% in her lifetime, like 8 out of 10 times in her lifetime, she will get the virus.
Right.
For men, it's 9 out of 10 times in their lifetime they've gotten the virus. It gets worse. For adolescents, now there's very young children, 18 years and below, by the first year of sexual debut, about 50 to 80% will have the virus.
Right.
And you see, for them, their immunity is low, their biology is not good enough to fight the virus. Because most of us, we fight the virus, we clear it, not a problem. But for adolescents, that's why they're a high-risk group in terms of getting this virus and it causing more problems for them and staying. And one thing I need to mention is that just having the virus does not mean that someone is going to have cancer.
Right.
As I said, most of us will clear it. If I say I have like 10 women, I screen them, 8 turn positive, 7 will be fine. They'll clear the virus in a year or so, and they'll be okay. But there's that one woman who will not be able to clear the virus. And that's the one woman we're looking for. Because we can't predict. We can't say, no, it's Maureen who's going to keep the virus. Oh, it's so-and-so who's going to keep the virus. No, you can't. So we have to screen and see who has the virus at the time and then run the additional test.
Right.
And the reason why some women are unable to clear the virus is because of a myriad of other things. One of the commonest is immunosuppression.
Right.
Things like HIV, or they've had kidney transplants or any kind of organ transplant. They're on immunosuppressant drugs. Women who've been smoking or even have a history of smoking. People who have other sexually transmitted infection, particularly chlamydia and gonorrhea. Those two have been associated quite a lot with development of cervical cancer. And women who've had many children. And many is not what we think about 7 or more. We were Africans. So we're used to having women who've had 10 children or more. But studies have shown even having more than 3 children is a sufficient enough risk for HPV to actually stain the cervix, because that cervix has dilated and been damaged through childbirth for it to keep the virus and you're not able to clear it. And then another risk factor is having multiple sexual partners or having a partner who has multiple sexual partners. Then of course you're now exposed to more viruses, more types of HPV. But the HPV is a very social virus. Oh my gosh, you have type 16. Type 16 feels comfortable there. It will call type 6. So you have genital warts, you have cervical cancer, then you have type 18 coming in. As it will call all these things. It will even call chlamydia, come on in, let's join up and join forces. So it's a very social virus. So you create an environment where it can thrive. Because for it doesn't know that it's causing a problem. It's just trying to survive. You know? And so when we have women with all these risk factors, then that's when we are able to know, or rather we can associate why the virus has persisted in them. Because for a woman who tests positive for HPV for more than 2 years, that means it's persistent disease. And that's when we really have to be careful about the risk of developing cervical cancer or the changes that become cervical cancer. And so when we're testing a woman, like if I test someone right now, I can't know when she got the virus, you know. So yes, you'll turn positive. Doesn't mean that you have any problem until now we run a diagnostic test. Yes.
That's been a good conversation. Thank you so much for being with us. We have had with us today Dr. Anisa Mburu, a gynecologic oncologist, and we've been discussing HPV DNA testing, and cervical cancer, and how we can be able to work together to eradicate cervical cancer from our population. My name is Dr. Maureen Wedaka. Thank you for joining us.
And thank you for having me.